Hello, this is Dr. Collins Harrell. I want to teach you how to do limited case types in the Medit Orthodontic Suite. We've acquired a scan, and we have a patient here who is mostly interested in aligning the upper and lower anterior teeth because the patient has had some relapse from previous orthodontic treatment. So from this scan in Medit Link, we're going to open the Medit Orthodontic Suite. Now we're going to assign the data, so the mandible and the maxilla, and we're just going to assign that. Even though we have some other data for this patient, we're being warned that we don't have a Ceph assigned, but I'm going to show you how we can do these limited case types even without a lateral Ceph. The first tab that is opened allows us to fill any holes or trim any unnecessary data, which we don't need to do in this case. Next, we'll set an occlusal table. This one looks acceptable. If you don't like the way that the occlusal table is set, you can detach the data, and then you can redo it by placing 4 points symmetrically on the model. I'm using the distal buccal cusp tips of the lower first molars and the buccal cusp tips of the lower first bicuspid, so the 6s and the 4s. The next step is to identify each tooth and segment the teeth. And this one fortunately gives us a chance to show you how we make some corrections when it doesn't identify all of the data correctly. So here you can see this tooth 3 has got too much paint onto the gingival margins. And if you ever see something strange happening in the simulations, it usually has to do with somewhere like up on the buccal where you didn't notice that the tooth has been segmented onto the gum tissue. So I'm just going to click Erase All. And then I'm going to double click on that tooth again using the Smart Tooth Selection tool, and it will re-identify that tooth. And then we have a problem over here with tooth 6 because it's not real well delineated, this change between one tooth and the other here, between the tooth 6 and tooth 5. So I'm going to erase the whole thing. I'm going to see if I can click on a spot where it will only select the 6. There we go. Sometimes just changing the angle a little bit helps, and then I'll use this brush to just fill in this little bit. Now I can confirm that. Now to get the 5, I have to come over here on the left and click this grayed out tooth and say Find Teeth, and double click on that tooth, again using the Tooth Finding Wizard. Let's erase all and see if we can change the angle a little bit and get that to select just this tooth. There we go. And we'll confirm that. And then looking at the lower arch, it looks like everything is numbered correctly. So we'll move on to the next step. This next step is where we choose the arch form for aligning these teeth. And it's going to default to the medium ovoid arch form. It looks a little bit constricted. I'm looking at the anterior portion especially, since that's what I'm concerned about in this case, but it looks a little bit constricted for this patient's arch form. So I'm going to choose one, maybe this non-extract ovoid number 1. That's got a little bit more expanded arch form. And I'm going to make sure that it's centered left to right, so it's centered in the middle of the arch form. And then I'm going to, with a right click on my mouse, it may be different on your mouse, but I'm going to adjust the angulation to make sure that it's sitting symmetrically on the way that it's touching the posterior teeth, and especially on these anterior cases, kind of looking at how it's resting against those anterior teeth. And over here as well, just going to do a little bit of adjustment, looking at those posterior teeth to kind of guide me to make sure that it's positioned symmetrically. And then we'll click Next. Now here it's already chosen class 1 on this bite, but if this is a class 2 or class 3 case and I'm really just interested in anterior alignment, I might just force it over to class 1 because I'm not going to be paying any other attention to other simulations besides the anterior alignment only on a case like this. It's still going to prepare all of the simulations for us. So we have the whole list of simulations, but we're going to focus in this case just on the limited anterior simulation. So the simulations are produced, and we have a whole list of different simulations that have been produced here. Extractions, non-extractions, expansion, and IPR, all these different choices. It always defaults to simulation 1.1, which is treating the whole entire arch. So you can see here, if I click this animation tool, that simulation 1.1 is treating the whole arch. That was an expanded arch form, so you can see the expansion happening. In this case, I don't want to treat the whole arch form. I just want to deal with those anterior teeth. So I have some choices here, upper and lower, 3 to 3 only, and then same thing with IPR just in the upper arch, maybe for a case with too much overjet. And then 1.13 is anterior alignment only with IPR just in the lower arch. And then we have upper and lower IPR, again, just anterior alignment only. So in this case, let's see what it looks like if we just choose this anterior upper and lower 3 to 3 only. Now the movements here are restricted. It's even in the anterior, it's only going to move the anterior teeth so far. So if it's a case that's not really appropriate for a limited case type, it's not going to look like the teeth in the front got straight. But for these cases where you're closer to being done with limited movements, you're going to get a lower number of aligners, you're going to get limited movements, and this is a really nice selection of the simulation to be able to get these more limited case types. Now there's not enough overjet in this case, and so I'm going to choose 1.13, which puts IPR just in the lower arch so that we can create a little bit more overjet. And that selection looks to be more appropriate for this patient. One of the things I noticed earlier on this case is that it's not really aligning that root. The angulation is not correct on this tooth. So I'm going to show you a quick fix for that one before we go to the aligner output stage. There's a tooth orientation tool here. And if I go to that one tooth, let's just correct the rotation here a little bit while we're at it. And then let's click the angulation tool. Now I'm going to change the angulation so that it more appropriately represents the true angulation of this tooth. So we're going to move this blue line to where it's down at the base or the lowest part of that gingival zenith. And then the upper, I like to kind of keep it level with the occlusal, with the incisal edge if possible. But let's see if that does a better job of fixing the angulation of that tooth before we move on. Now you could have done this later, and I'll show you how to do that later, but this is sometimes something I'll go and fix. You can see how that corrected that one tooth right there. It makes it a little bit easier for me down the road. So let's select this option and move on to the next step, which is aligners. And it's going to produce aligner staging for us based on this simulation. And then just like getting a ClinCheck or a setup back from an aligner company, I now have a lot of different options for customizing, making this exactly the way I want. So you can see that it's staged. It has attachments on the teeth, which I may or may not want, but the staging has been done for me. I have, looks like 10 aligner stages in the upper and 16 in the lower because there was a lot more crowding down there in the lower arch. Let's see what that looks like. So you can see we're expanding, creating space to correct those rotations without any collisions, and then it's finishing it up. If I'm happy with that, I can just move on, but I usually make some adjustments. So I'm going to use this tool down here. It says treatment refinement. If I want to include attachments or not, I have a choice to turn them on or off right here. But I can click down here on this treatment refinement tool, and I have the option of fixing the tooth movements, the final positions, adjusting any IPR or spacing in the case, and editing the attachments. So I'm going to go and do a little bit of tooth movement on this case. For example, there we go. When we have that activated, the tooth movement control panel comes up over here. And any tooth I click on, it's going to show me how much movement has been programmed into that. Again, these are limited so that we don't get massive amounts of change to these teeth. That way we can get these more limited case types done efficiently. But this particular tooth, I don't feel like the rotation is all the way corrected, so I can click on rotation and come over here and make that look just the way that I want it to look. Same thing with this tooth over here, a little bit of a rotation correction there. If you want to program in an overcorrection, this would be the place where you might do that. Now I can come back, and when I click away from the model, it shows me the starting position of the teeth versus the final position of the teeth. And if there's anything that I don't like or I don't feel is necessary, I can come over here and I can either type in the number that I want. So say I feel like there's too much angulation change. Maybe this tooth, maybe on that canine, I don't need that much of an angulation change. And so to make this more predictable, I could go back to initial position, or I could just come over here where there's 5 degrees of mesial crown tip added, and I could change that to say just 2 degrees. Oh, I did that to the wrong tooth. I had this one highlighted over here. Let's come over and do that to this one. So let's change 5 degrees of distal angulation to 2 degrees. And now we need to go in and adjust the IPR a little bit. So let's get rid of that and let's dial this one down. But now when I go back to the tooth movement, I can see that that doesn't have as much angulation change programmed into it. So we make this just the way we want in the upper and the lower. You have the option of moving one individual tooth or a group of teeth. So here I might choose this one tooth to give a little bit of extrusion so that it matches these other teeth a little bit better. And I might choose the whole group by holding down the control button. I can grab all of these incisors and I can actually move them down, intrude them a little bit as a whole entire group. Let's see what the upper arch looks like. So if I want to add a little bit more mesial crown tip to this tooth, I can go change the angulation here. That was the wrong direction. I can just click in a couple more degrees of angulation change. That looks better to my eye. You might do the same thing over here. And then I'm going to have to make a decision. This tooth here has got some severe wear on the lingual side, so maybe I want to just bring that tooth down a little bit. So I'll just manually pull that down to where the incisal corners line up a little bit better, knowing that I can later come in with a disc and kind of shave that part down a little bit. Now those gingival margins are going to line up a little bit better, and it will be a little bit easier for me to make these anterior teeth look really nice when we're done. So any little changes like that I make, same thing, we have IPR, spacing options that we can add here. So I can add IPR, I can delete it. Or we can change attachments. So we can go here and say, hey, I want to delete this attachment altogether, or I want to change the size of an attachment, or maybe I want to change the angulation or put a bevel on an attachment. So I can, if I click the arrow correctly, I can bevel that one direction or the other, or I can change the orientation on the tooth or the position on the tooth. I can add new attachments. So maybe delete the vertical one and add a horizontal one. Change the size. Any changes I make to anything here, IPR, attachments, or tooth position, will be factored back in when I click this blue checkbox on the lower right-hand corner, and it will restage the case for me according to the changes that I made. And you can always access Bolton data and tooth movement data over here. So here's the Bolton analysis. I can show the Bolton analysis with and without the IPR, so you can see that there's a larger discrepancy in the lower. Until I've done the IPR, then that discrepancy goes down. That's kind of a nice feature right there. Oh, I do have this feature here as well. If you want to change the speed of the movements, or maybe just have it reprogram the movements, clicking on this little settings icon will give you the chance to change the speed of your tooth movements. And sometimes just making little adjustments here will cause it to recalculate, and sometimes you get out something that you might be a little bit happier with. If you want to try to get the staging to change a little bit, I'll go and speed up or slow down a case to be able to make some changes there. But when you're finally happy, you're going to go ahead and click this complete button in the lower right hand corner. Now you can send this off to Meted Aligners to be professionally manufactured, printed, sent to your office. or you can export these files and make them yourself. So maybe a case where you have only 6 or 7 of liner stages, you can go ahead and export how many stages you want. You can skip stages if you want. You can do upper and lower. It gives you a lot of options here. So hopefully this has been helpful, and you'll be able to use Meta Orthodontic Suite for your limited case types with ease. Please reach out to us if you have any questions. Thanks for listening.